Effective strategies for managing and preventing depression. In this video, I will be showing to you the effective strategies that you can use to manage and prevent depression. Let's go and check it out. I help individuals or groups struggling with distractions, stress, frustrations, confusion, bipolar tendencies, and lack of self-control develop unshakable mental discipline. Allow them to have their brain under their own control instead of being controlled by it. So that is what I do. I help individuals, groups that are having issues with distraction, stress, frustration, and what have you, and also people that lack self-control. I help them to develop unshakable mental discipline, which allows them to have their brain under their own control instead of allowing their brain to control them. This way, they can achieve their goals with focus, confidence, and resilience without falling into the trap of becoming perpetual sadists, suppressing emotions instead of mastering them. Number 1, prevention strategies. So we will be taking a look at the prevention strategies first. What are the prevention strategies? Awareness and education. Awareness and education is one of the preventive strategies of depression. Understanding depression is the first step towards prevention. So understanding depression is very important as a step towards prevention. There is no way you can prevent what you are not aware of. There is no way you can prevent what you don't have enough information of. There is no way you can prevent what you do not have enough education on. So for you to be able to prevent depression, the first step is to be aware and to have enough education about it. Familiarizing yourself with the symptoms. Yes, you need to know what the depression is. You need to know what the symptoms are. So you need to familiarize yourself with the symptoms such as persistent sadness. Okay, that is one of the symptoms of depression, fatigue, and loss of interest. Okay, so you need to familiarize yourself with these symptoms so that you can be able to identify them when they show up. Persistent sadness, fatigue, and loss of interest are one of the symptoms of depression. And for you to be able to prevent depression, you need to know what the symptoms of depression are. So familiarizing yourself with the symptoms such as persistent sadness, fatigue, and loss of interest can help you identify early warning signs. So when you familiarize with this yourself with the symptoms, it empowers you to identify early warning signs. And identification of early warning signs is very important in management of depression. Education about common triggers. So you don't only stop at awareness of the symptoms, you also need to educate yourself about the common triggers like stress, trauma, or significant life changes. Stress, trauma, or significant life changes are one of the triggers. They are one of the triggers. They are one of the events. When we say triggers, we mean events that depression is rooted in. Okay, the event that is empowering that depression. What happened? What precedes the depression is what we mean by triggers. So things like stress, trauma, or significant life changes empowers individuals to take proactive measures. So when you educate yourself about the triggers, you are able to take proactive measures such as seeking therapy or engaging in stress reduction techniques. Once you know the triggers, you are able to know when the triggers are approaching, when the triggers are maturing, when the triggers are coming up. So you are able to seek therapy or engage in stress reduction techniques. Support systems is one of the preventive techniques of depression. A strong support network is crucial. So you need a strong support network, which is very, very crucial. Building and maintaining relationships with family, friends, or support group foster emotional security. And you know, one of the issues of depression, one of the issues of anxiety is withdrawal from friends and family. So it is important that you build and maintain relationships with family. You need to stay around people that cares, and because you need their support. So building and maintaining relationships with family and friends or support groups foster emotional security. This is to ensure that you have emotional security. Regular interactions and open communication create sense of belonging, reducing feeling of isolation. Okay, regular interaction and open communication create a sense of belonging, reducing feeling of isolation. Okay, so you don't feel lonely. Okay, there is difference between you being alone and you feeling lonely. When you feel lonely, it is an issue of mental health. The feeling of loneliness is an issue of mental health. Okay, so regular interaction and open communication create sense of belonging, reducing feeling of isolation. That is why support system is very, very crucial. Encouraging open conversations about mental health within your cycle can also destigmatize the experience and promoting mutual support within your circle. When you discuss about it, okay, you have open conversation with yourself, it destigmatizes the experience and promotes mutual support. Please, I need to subscribe to my channel, share and like and comment. It's a form of motivation for me. Subscribe, I will appreciate it. Routine checking. Another form of preventive measures is routine checking. Routine mental health check-ins, whether self-guided or through professional evaluations, are essential for early detection of depressive symptoms. Okay, so you need to do routine checking. You need to do routine appraisal so that your mental health condition is appraised for early detection of depressive symptoms. Because I have said earlier that early detection of the symptoms of depression is very, very important in managing depression and anxiety and every other mental health issue. Early detection is very, very important in management of every other mental health conditions. Keeping a journal to track mood changes, thoughts and behavior can provide valuable insights. So when you keep journal to track your mood changes, to track your thoughts, to track your behaviors, it can provide valuable insights and valuable information and even valuable warning as at the approach of depression. Sharing this reflection with a therapist can facilitate a deeper understanding of emotional patterns and guide appropriate intervention. So you need to share this journal, whatever you journal, you need to share it with a therapist so that they can understand and have idea of where to direct their operations to, so that they don't leave anything uncovered, so that they don't leave anything untouched. That is why it is important that you keep journal of your mood changes, of your thoughts and your behavior, the way you respond to those mood changes and thoughts, and the frequency, including the triggers of those mood changes, thoughts and behaviors. I have a free ebook for you. Okay, this free book is titled How to Own Your Actions. How to Own Your Actions, a guide to personal accountability for growth and success. Your inability or anybody's inability to own their action is a reflection of poor mental state. Okay, when you are unable to be accountable to yourself, it is a reflection of a poor mental state. So this ebook addresses that. It empowers you and teaches you how you can own your actions and also guide you to achieving personal accountability for growth and success. This ebook also comes with a 7-day personal accountability challenge. Okay, it comes with a 7-day personal accountability challenge, and also it comes with a worksheet. So once you download the free ebook, I will send you the worksheet. The worksheet allows you to master, understand and put to practice all you are going to learn from the ebook. What are you going to learn in the ebook? The true meaning of personal accountability, a step-by-step self-audit method to uncover hidden patterns holding you back. So all the hidden patterns holding you back, you will uncover them. Then you are going to learn how to stop making excuses and start taking actions towards your goals. You are going to learn practical strategies for staying accountable in tough times and overcoming setbacks. You are going to learn daily habits that reinforce self-discipline, consistency, and resilience. And like I have said earlier, you will also have a 7-day personalized accountability challenge to jumpstart your transformation. This ebook is all about transformation. And also, who is this book for? Anyone tired of feeling stuck. So if you are tired of feeling stuck and ready to take control of your life, this ebook is for you. Download it. It is free of charge. Entrepreneurs, professionals, and students looking to develop stronger discipline, this ebook is for you. Individuals struggling with self-sabotage, procrastination, and lack of motivation, this ebook is for you. Anyone seeking to build resilience, confidence, and long-term success, this is what you need. It is free of charge. Then how are you going to download it? Check the video description. You will see the download link in the video description. Also, if you want to contact me, you want to discuss your condition with me, you want to discuss your state of mind with me, my contact email is in the video description. Check the video description for the download link of this free ebook. Check the video description for my email address. That is the way you can contact me. Let's move forward. Number 2, therapeutic approaches. Therapeutic approaches. One of the therapeutic approaches is cognitive behavioral therapy, CBT. So what is CBT? CBT is a widely used and effective therapeutic approach for depression. No doubt about that. It focuses on identifying and challenging negative thought patterns that contribute to emotional distress. So what CBT does is that it identifies one, then two. After identifying, it then challenges the negative thought patterns that contribute and that empower emotional distress. Okay, that is what CBT does. Through structured sessions, individuals learn to replace distorted beliefs with healthier, more balanced thoughts. So through structured sessions, through prepared sessions, you learn how to replace those disturbing thoughts, okay, those negative thoughts, those disturbing thought patterns. You learn how to replace them with healthier and more balanced thoughts. This method not only alleviates symptoms, but also equip individuals with lifelong coping strategies. That is the advantage of CBT. It does not only alleviate symptoms, but also equip you with lifelong coping strategies. Mindfulness and meditation. Mindfulness practices, including meditation and yoga, encourage individuals to focus on present moment without judgment. So you are able to be aware of yourself, your environment, and the present moment. That is what mindfulness and meditation will do to you. These techniques have been shown to reduce anxiety and improve emotional regulation. Regular mindfulness practice can cultivate resilience. Okay? Regular mindfulness practice can cultivate resilience, helping individuals respond more effectively to stressors and negative emotions. What are your stressors? Your stressors are your triggers. What are your triggers? Your triggers are your stressors. So mindfulness and meditation is going to empower you to respond more effectively to your triggers, to respond more effectively to your stressors and negative emotions. Medication. For some individuals, medication may be necessary. Okay, it may be necessary and it may be part of their components. Antidepressants can help balance brain chemicals associated with mood regulation. So when they give you antidepressants, what they are trying to achieve is to balance the chemicals in your brain. These chemicals are the chemicals that are associated and connected with mood regulation. So when these chemicals are balanced, your mood are also regulated. It's essential to consult a healthcare professional to discuss the benefit and potential side effect of medication, because this medication also comes with side effects. You will also be dealing with so many form of side effects. So that's why it's important that you discuss this with a professional. But one thing is that I don't always encourage only medication, because you need to understand that once these drugs are active in your body, as long as they are active in your system, they are going to put things under control. But the moment they are no longer active, the problem will resurface. Okay, so that is why you need a transformational program that is going to empower you to put things naturally under your control. Okay, to put things naturally, to put the condition naturally under your own control. 3, lifestyle changes. Okay, lifestyle changes. So what are the lifestyle changes that you can use to manage depression? Regular exercise. Physical activity is a powerful tool for managing depression. Regular exercise releases endorphins, the body natural mood enhancer. So endorphin is the natural body mood enhancer, and when you do regular exercise, your body releases these endorphins. Aim for at least 150 minutes of moderate exercise each week, whether through walking, cycling, or group sport. All that is important is aim for at least 150 minutes of moderate exercise. Moderate, okay? I stress and I emphasize on the word moderate exercise each week. Incorporating movement into daily routine can lead to significant improvement in mood and overall mental health. So make sure you incorporate movement of your body, stretching of your bones, stretching of your muscles, stretching of your joint. Make sure you incorporate it into your daily activities, because it's going to improve your mood and it's going to improve your overall mental health. Balanced nutrition. Balanced nutrition plays important, crucial role in mental health. Consuming a balanced diet rich in fruits, vegetables, whole grain, and healthy fats support brain function. So these items support brain function. They support mental health function. They support mental health function. So that is why you need to consume them. Fruit, vegetable, whole grain, and healthy fat. Make sure you eat food that is advantage to your health, because eating is also a form of medication. That is the truth. Eating is a form of medication. So when you eat healthy, you stay healthy. Omega-3 fatty acids found in fish and nuts have been linked to lower level of depression. Okay, omega-3 fatty acids is found in fish and nuts. It has been connected to lower level of depression. Reducing processed foods. It is important that you reduce processed foods, and also you reduce your sugar intake. Okay, you reduce your sugar intake. So reducing processed foods and sugar can also stabilize mood and energy level. Reduce your sweetie things. Okay, these things have negative on your overall health, so reduce them. You can't be using your money to go and be buying things that will turn back to affect you negatively. You work hard to make this money, then you go and be buying junks that will end up affecting you negatively. It doesn't make any sense. It doesn't make any sense. So reduce all the consumptions that do not add any advantage to your overall well-being. Sleep hygiene. Quality sleep is vital for emotional well-being. Yes, quality sleep is vital for emotional well-being. Establishing a consistent sleep routine, going to bed and waking up at the same time each day can improve sleep quality. So you need to engage in practices that can guarantee and deliver quality sleep to you, because when you achieve sleep quality, it have advantage and positive impact on your overall well-being, most especially your mental health. Because when your sleep is of high quality, it affects your brain function too. When you wake up, your brain function is reset, it stays calm, okay, and you are able to function very well. Create a calming pre-sleep environment by limiting screen time and engage in relaxing activities like reading or taking a warm bath to enhance restfulness. Okay, few minutes going to bed, relax yourself. Stay away from your screens, either your phone, either your TV, your laptops, okay, your tabs. Stay away from them so that you can stay relaxed. When you do things like this, it enhances restfulness. Your brain relax and rest. So by the time you go to bed and wake up, you feel relaxed, you feel refreshed, you feel reset. All these things have positive impact on the brain. Stress management techniques. What are the stress management techniques? Implementing stress relief practice can mitigate triggers of depression. When you practice stress management techniques, okay, it mitigates triggers of depression, it mitigates stressors, it prevents stressors, and it reduces stressors. Techniques such as deep breathing, progressive muscle relaxation, and engaging in hobbies or creative outlets can effectively reduce stress level. Okay, when you engage in deep breathing, when you engage in progressive muscle relaxation, when you engage in hobbies or creative outlets, it can reduce stress levels, and that is what you want to achieve every day. Regular scheduling time for relaxation and enjoyable activities help maintain emotional balance. Regularly scheduling time, so you need to create time for yourself. Regularly scheduling time for relaxation and enjoyable activities help maintain emotional balance. Health implication of depression. Depression certainly affects a person's ability to function, thereby affecting day-to-day activity. Depression will always affect your daily functioning. Okay, so it affects your ability to function rightly. It has the capability to lead to major health complications that may go beyond a person's emotional and mental health. Depression can lead to physical health problems. It can lead to major health complications that may go beyond a person's emotional and mental health. That is why you need to take your emotional health and mental health seriously. Some health complications of depression are it causes chronic pain. So that is why you see most people suffering from depression and anxiety and other mental health issues complain of chronic pain. It causes inflammation. It affects the cardiovascular and immune system. Of course, it will always do that. It causes gastrointestinal issues. It escalates already existing health issues. So all the already existing health issues will be escalated. It destroys the central nervous system. It negatively decreases libido. It leads to insomnia. It can lead to stroke. That is the height of it. It can lead to stroke. So depression, anxiety, and every other mental issue can lead to stroke. It can lead to heart attack. It can lead to diabetes, and it can lead to high blood pressure. Effectively managing and preventing depression requires a motivated approach that includes, so if you want to effectively, I stress the word effectively, manage and prevent depression or anxiety or any other mental health issue, you don't use one approach. You have to use bunch of approaches, and which includes awareness, supportive relationships, therapeutic interventions, and healthy lifestyle changes. Recognizing the importance of mental health is the ultimate step towards well-being. So you need to recognize how important your mental health is so that you can take it seriously, and it is the first and ultimate step towards your overall well-being, paving way for a more fulfilling life. Okay, when you are balanced and you are okay in the head, it's going to pave a way for a more fulfilling life. And this brings us to the end of this video. And again, don't forget to go and download the ebook that I talked about. It's going to help you a lot. It is free of charge. Once you download it, I will send you the worksheet, And again, like, share, and subscribe to my channel. My email is in the video description. The link to download the video, the link to download the free ebook is in the video description. The link, I'm repeating that, the link to download the free ebook that I talked about is in the video description. Also, my email, my contact is also in the video description. Thank you for joining me in this video. See you next time. Bye bye.